To kind of break this all down. Good morning, doctor. How are you doing? And thank you so much for joining us this morning.
Good morning. I'm feeling very blessed today, and thank you for having me.
What was your reaction yesterday with the CDC's new guidance in terms of both vaccines and masks?
Well, the reaction yesterday, it wasn't quite surprising. It was a little bit disappointing, but not surprising, given the new strain that we have, the Delta strain, which has become the dominant strain in the United States. As people know, and they were explaining that the new variant, the Delta variant, is really um, highly transmissible because once you get it, even if you're vaccinated, you can have, now it's pretty rare, but it is possible to have a very high viral load and transmit to somebody else, even though you're vaccinated. So I can understand why they change.
For those who feel like this is a huge step backwards, what would you say to them?
Well, it's basically based on the information that they get, what the data shows. When they made the decision 2 months ago, it was based on the Alpha variant. But now, well, you have the Delta variant, which is different molecularly. So I can see why they make that change. And people need to understand that this virus is very dynamic. It keeps mutating. So right now we're dealing with the Delta variant, and the Delta variant causes more problem. It can multiply more in the nasopharynx. So therefore, it's important to wear a mask. It's unfortunate, especially if you've gotten vaccinated, but that's necessary.
I would say a lot of parents here. Some students are already in school. My niece and nephew, they're in Chandler, Arizona, year-round school. They're already back in the classrooms. Out here in Central Florida, we are literally just days away here. August 10th is the main start date for a lot of students out here. So think so close to returning to the classroom. All of these policies need to be looked at again. What do you think about school districts and counties and cities that are having to deal with this essentially during crunch time?
Well, unfortunately, we have to adjust, and that's the problem. We wish we could have had this behind us, but we're still in the middle of the pandemic. We have to adjust. It's going to be a big adjustment for some of us, but that's necessary. Safety is collective. It's not just my safety, but it's our safety. Unfortunately, we have to be more flexible now, and some parents, they've gotten frustrated, understandably, and but that's something that we have to do for the safety of everyone.
Do you think that it is the right move for employers to require their workers be vaccinated?
Well, I can't really comment on that because there's been controversies in terms of um, the vaccine not being regulated. It's under emergency use right now. So it's gonna have to be the employer's decision to decide. But people who are unvaccinated, they really should think about getting vaccinated. I mean, this is crunch time now. It's really time for everyone, the 100 million Americans who have not been vaccinated, to decide to get vaccinated, because that will be very helpful.
Is there anything else? You talked about it at the beginning, and I just want to reiterate it again. You're saying vaccinated people should be masking when indoors, when in places across the country that are having high rates of transmission, and that's because even though they are protected against the virus, they can still give it to others. Is that right?
That's correct. Even if you're vaccinated, there's a chance, now this is not common, but there's a chance that you can have a high viral load, just like the unvaccinated person in your nasopharynx, and transmit the virus even though you're not very sick. I've seen patients in the hospital where they actually got vaccinated. They come for some other reason, but they were found to have infection. They're not as sick in terms of respiratory condition, but they still carry the virus. They still have infection. And if you have infection, you can transmit. There's a chance that you can transmit. That's why you wear the mask. So
especially,
I'm asking everybody to be patient, and most importantly, encourage your neighbors, encourage your family members to get vaccinated, because the vaccine is safe and effective.
what are your thoughts on the number of breakthrough cases that we keep hearing about for fully vaccinated people?
Well, I would say it's a little bit disappointing that you get vaccinated, you still have breakthrough cases, but it's understandable, because what happened is when you are unvaccinated, so many people are unvaccinated that actually take the pressure of the virus, giving the virus the chance to mutate. So when that happens, then everybody's in trouble in terms of the virus being mutated. Then there's a chance that you can contract the virus, even if you're not sick, if you vaccinated.
In terms of the breakthrough cases, you talked about it a little bit already. You're saying that if you're fully vaccinated, you contract COVID-19, even if it's the new Delta variant, you're a lot less likely to be hospitalized, to end up on a ventilator. Is it, and you were talking about other infections as well, would that be considered a mask a result of? So say you have strep throat or some other virus, is that technically still COVID but being masked as another virus?
That's a very good point. Don't forget, even though we're dealing with COVID-19, there's still a lot of other viruses out there. And we're going to be dealing with winter season, which is probably going to be very challenging. So if you're having any symptom right now, the first thing you should do basically is to test for COVID, because we're still in the middle of the pandemic, but you may also have other type of infection, be it viruses or bacteria.
All right, doctor, anything else that you would like to tell me or our viewers? Perhaps I didn't ask you this morning.
But again, I'm urging everyone in the community to really think really hard in terms of being vaccinated, because the reality is we would not be in this position, in this predicament, had people get vaccinated. And I understand some people have their reasons for not being vaccinated, but think about it, consider it. I personally got vaccinated in December. My family got vaccinated, and the vaccine is safe and effective. I'm urging everybody who have not been vaccinated to get vaccinated in order to deal with this, because the most effective way to get out of this pandemic is through vaccination. Even though we're using the public health measures, social distancing, wearing masks, that's not sufficient enough. We need the vaccine. We need to get vaccinated. If you're 12 and above, you need to get vaccinated so we can move on with our lives. Otherwise, we will be in the same predicament. It's going to be variant after variant causing problems.
All right, infectious disease doctor, Dr. Francois Cadet, thank you so much for joining us live here this morning on Live Now from Fox.
Thank you for having me.
Most of you are going to see a 2-minute commercial break. We'll be